has been proposed that PPD is caused by deficiency of allopregnanolone in peripheral blood or cerebrospinal fluid. Allopregnanolone is a metabolite of progesterone, function as positive allosteric modulators of GABA-A receptor. Allopregnanolone bind to GABA-A receptor and activate the inhibitory action of the receptor, so it will eventually upregulate the neuronal activity. This finding lead to a series of studies on how this metabolite fluctuate during the time of stress. Research indicated that the concentration of allopregnanolone increased during pregnancy but drops after delivery. This drop triggered the development of depression and anxiety. From this basic research finding, a biopharmaceutical company developed brexanolone, which is now marketed as Zulresso to treat PPD. Women were randomly assigned to the brexanolone and placebo group. BRX and placebo group was given as continuous intravenous infusion for 60 hours. In the study, Hamilton Depression Rating Scale (HAM-D) total score was used for assessing symptom and depression. For the result, at 60-hour mean reduction in HAM-D total score from baseline was 21.0 points in the brexanolone group compared with 8.8 points in the placebo group. The most frequently reported adverse events in the brexanolone group were dizziness and somnolence. Moderate treatment emergent adverse events including sinus tachycardia and somnolence were reported in 2 patients in the brexanolone group, while 2 patients in the placebo group were reported with infusion site pain and tension headache. Another 1 patient in the placebo group had a severe treatment emergent adverse event, which is insomnia. In women with severe postpartum depression, infusion of brexanolone resulted in a significant and clinically meaningful reduction in HAM-D total score compared with placebo. Our results support the rationale for targeting synaptic and extrasynaptic GABA-A receptor in the development of therapies for patients with postpartum depression. In Study 1, 138 participants were randomly assigned to receive either BRX90, BRX60 or placebo, and 108 participants were randomly assigned to receive BRX90 or placebo in Study 2. In Study 1, at 60 hours, the least square mean reduction in HAM-D total score from baseline was 19.5 points in the BRX60 group and 17.7 points in the BRX90 group, compared with 14.0 points in the placebo. In Study 2, at 60 hours, the least square mean reduction in HAM-D total score from baseline was 14.6 points in the BRX90 group, compared with 12.1 points in the placebo group. From the both studies, some of the participants had shown adverse effects. The most common treatment-emergent adverse events in the brexanolone groups were headache, dizziness, and somnolence, and only one patient from both of the studies had shown serious adverse effect, including suicidal ideation and intention overdose attempt. Administration of brexanolone injection for postpartum depression resulted in significant and clinical meaningful reductions in HAM-D total score at 60 hours compared with placebo, with rapid onset of action and durable treatment response during the study period. Our results suggest that brexanolone injection is a novel therapeutic drug for postpartum depression that has the potential to improve treatment options for women with this disorder.